welcome back. This video we're going to be going over the pulmonary system for nuclear medicine. I'm currently a first year nuclear medicine technologist student. So the first drug we're going to be using for the pulmonary system is the technetium-99 MAA microaggregated albumin. So this is the protein. It's going to be injected intravenously. Particles are going to lodge temporarily in the pulmonary capillaries in proportion to the blood. So the uptake is the technetium-99 MAA is going to be trapped in the pulmonary arterioles and capillaries and not metabolized by the body. So the distribution pattern shows perfusion to each lung region. So the left lung has 2 regions and the right lung has 3. So we're going to say they're going to be lobes. The left has 2 lobes, the right has 3 lobes. The result for the imaging, we're going to be doing perfusion lung scans, which are called Q scans. We're trying to detect pulmonary embolism. And there's also quantitative perfusion studies, which are used for surgical planning. So you want to be able to map out what's going to be surgically removed before your doctor actually goes in there. So this is one of the reasons that we are going to be using this study, or this particular drug. So in the next video, we'll talk about Right, the next drug in the pulmonary system. We're going to be using xenon-133 gas. That was Oliver burping. So the mechanism for this is going to be inhaled radioactive gas, which is going to follow the airflow into the alveoli. It's going to diffuse into the alveoli and partially into the pulmonary capillary blood. The imaging result, you're going to have ventilation images that show inhalation, breath held, and washout phases. The reason for the imaging could be part of a VQ scan, so that's the pulmonary perfusion ventilation study. And what we're looking to detect are regional airflow abnormalities, potentially revealing COPD and asthma. For the third drug that we're going to use for the pulmonary system, we're going to be using technetium-99 DTPA aerosol. So one of the mechanism is it's nebulized into fine particles, inhaled, and deposited throughout the airways and the alveoli. It stays in the airways and alveoli. It's cleared gradually by mucus transport and absorption into the bloodstream, and the aerosol is going to be compartmentalized into the lungs. Distribution patterns show ventilation. So what we're looking for is how much each part of the lung is being used or not. So uniform uptake, non-uniform uptake indicates airway obstruction. So the reason we use this is it's easier to administer to peds and critically ill patients. So that's it for the pulmonary system.